Put your finger on your eyebrow and push it upwards about a centimetre. It's not a diagnosis, but it's a clue. People come and see me all the time because they've got heavy looking and heavy feeling upper eyelids. They think that the rest of their face looks younger than their eyelids, and quite often their eyelids are affecting their ability to see properly. After a few seconds of talking to them, it becomes clear that they think they already know what the problem is. I'm Chris, a consultant ophthalmologist, and eyelids is what I do almost every day. I can't examine you through the screen, so everything that I say today is not a diagnosis. But I can tell you what to look for when you're looking at your face in the mirror. There are three main things that can contribute to a droopy looking eyelid. And of course, some people have a combination of all three. I think it's important to name all three. Eyebrow droop is known as brow ptosis. Remember, ptosis has a silent P. Upper eyelid droop is called blepharoptosis, or simply ptosis for short. And extra skin to the upper eyelid or hooded eyelids is known as dermatochalasis. So, what to look for in the mirror? It needs to be good lighting and you need to have a relaxed face, and that's easier said than done. First thing to do is find the edge of your eyelid. The edge is where the skin meets the eyelashes. Have a look at how low down on the eye this is. Is it above your pupil? Is it cutting through the middle of the pupil, or is it covering your pupil altogether? If it's covering your pupil partially or totally, that's a good clue that actually the eyelid itself has dropped. This is what we call ptosis. Again, that's an observation, not a clinical diagnosis. Next is the eyebrow. Do what we did at the beginning, put your finger on your eyebrow and lift it about a centimetre. If this means that you can now see your eyelid that you may not have seen for 10-15 years, then it's a good clue that the eyebrow is contributing to your problem. Of course, you could have a combination of all of these. The last thing I think we should do is have a look at the forehead. Are you constantly raising your eyebrows subconsciously to get them out of the way or to help get extra skin out of the way? Are you causing furrow lines in your forehead? Try and look at yourself in the mirror with a completely relaxed forehead and see what happens to the brow. Each one of these problems is dealt with in a slightly different way by an oculoplastic surgeon. A droopy eyebrow means doing surgery to lift the brow. A droopy eyelid needs surgery to lift the lid. And hooded eyelids or excess skin simply needs a procedure to remove that excess skin. So it's entirely possible for a surgeon to remove excess skin from the upper eyelid and do it beautifully. But it doesn't solve the problem because the patient either has a droopy eyelid as well, or a droopy brow, or of course, both. Although there's been no complications from this operation, the patient's not going to be very happy about the result. Now, before you go and try all of this yourself in front of the mirror, there are a few situations where a droopy eyelid needs dealing with urgently. If you think that a droopy eyelid has come on very rapidly, or if you have rapid, sudden onset of double vision, where things are splitting into two images, or if you've noticed in the mirror that one pupil is bigger than the other, I think you need to seek urgent medical attention straight away. I should mention that none of this information is relevant when we're talking about children. If your child has a droopy eyelid, it's most likely that it's been there since birth. A droopy eyelid in a child can affect the development of normal vision, and I therefore recommend seeing a doctor regarding this. So remember, mirror, good light, relaxed face, and a finger on the eyebrow. It won't necessarily give you the answer, but it will give you better questions to ask when somebody is examining you properly. Once you've got an idea of what's actually going on, the next question is, what can you do about it? I'll cover the treatments of brow ptosis, upper lid ptosis, and dermatochalasis in a future video. If you found this useful, that's what the subscribe button is for.